Ultimately, we were disregarded. We became inconvenient.
Dr. Jeannie Marazzo was a top scientist at the National Institutes of Health until late March, when she was placed on administrative leave. She'd clashed in a meeting with newly appointed Trump administration officials over flu vaccines in a season when at least 279 children had died from the virus.
We pointed out that, in fact, 90% of the deaths at that time were occurring in kids who were unvaccinated.
But in a new whistleblower complaint filed to a federal watchdog, Marazzo says Dr. Matthew Memoli, then the acting director of NIH, said vaccines are unnecessary if populations are healthy. That mirrored something often said by Health and Human Services Secretary Robert F. Kennedy, Jr.
It was a little bit like hearing the echo of what Secretary Kennedy had been promulgating in terms of healthy kids.
And you had never been in a meeting like that where the personal and political views of the HHS secretary permeated down into conversations about science?
Never.
Marazzo, a civil servant, succeeded Dr. Anthony Fauci as the nation's top infectious disease official.
It's not recommended for healthy people.
She's speaking out as Kennedy faces new bipartisan criticism of his leadership. Is he qualified to be doing the job he's doing?
No.
Is he dangerous?
Yes.
Why?
He's dangerous because he ignores the evidence, and he appears to be driven by a desire to satisfy a need to tear things down.
For example, Marazzo fought to preserve billions of dollars, including funding for pediatric cancer, HIV, and tuberculosis that was abruptly suspended.
We were sort of a voice in the wilderness, and just trying to say, wait a minute, people are going to be left hanging without medications, without checkups.
Marazzo was told she'd be transferred to the agency handling Native American health services. She says it's retaliation.
They didn't want somebody in that position who was going to argue about what they thought was right.
Ed O'Keefe, CBS News, Washington.